Now for the next type of imaging modality, imaging procedure we should be looking at in orthopedics is what is known as a facetography. Okay. Facetography. So it's just a specialized imaging technique, and it's used to study facet joints of the spine. Typically they use contrast injection. Okay, so it's also called what? Facet Joint Arthrography. Okay, all these joints, you know. So arthrography is generally for joints. So this one now is the facet joint. So you can see facet joint arthrography. So it's an imaging procedure where the contrast dye is now injected into the facet joints of the spine to visualize them. When you do an X-ray, CT scans, or fluoroscopy, you do it you get to see it better, you know. That's just what is there. You get to see it better. Okay, so that's what we got. So it evaluates the facet joint pathologies like arthritis could occur there, degeneration could occur there, inflammation could occur there, you know. So your needle is guided into the facet joint under imaging, contrast dye is injected, images are taken now to access the anatomy around that place, you know. Okay, so clinical uses: to diagnose back pain. What is the cause of back pain? You know, assessment for what? Arthritis, you know, degeneration in the spine, evaluation of trauma affecting spinal joints, and guidance for what? Injection. Sometimes you want to give you an injection there. So risks and consideration is actually an invasive procedure, so you have to be careful. Possible complications could lead to infections, bleeding, and allergic reactions. Okay. So it's usually performed when MRI or CT scans are inconclusive. It's not usually a first line of what, you know, procedures.